8 million. That's how many people the Obama administration says enrolled in health exchanges under the Affordable Care Act. But is that number accurate? Joining us now is Dr. David Hogberg, a healthcare analyst with the National Center for Public Policy Research. Dr. Hogberg, good to have you join us. Let's talk about that number, 8 million. That's how many people the Obama administration says has signed up. Do you agree with that number?
Well, I think the initial number when they compiled it in April might have been accurate, but there are a number of problems with it. The most recent being that 2.1 million people have either submitted some type of erroneous income information that can affect the subsidy they get, and then there's about another 1.2 million of those have submitted erroneous income information, and then another 900,000 it's not clear what their immigration status is. So the administration now is going to do sort of audits of a couple 100,000 of those people, trying to give them a chance to update their income information or prove that they're citizens, I suppose. But as for 8 million, I suspect it's not going to be accurate.
Well, and also 8 million might have been the number of people who signed up,
sure,
but you've got to pay your premium.
Mm-hmm.
So that's a totally different number. Wouldn't you agree?
Oh, absolutely. I mean, the estimates are maybe 10 to possibly 20% won't end up paying their premium.
And does that mean that they'll then take the penalty?
Presumably, yes. I mean, if you're not signed up for Obamacare and you don't have some sort of hardship exemption, you're going to end up paying the penalty. And then you add to that the fact that some of these people on the exchange will get a job with an employer who provides employer-based insurance. Some will see income losses and drop down into Medicaid. The UC Berkeley Center Labor Center did an analysis of the California exchange, and they projected that about 40% of the people on the California exchange by the end of the year would either get employer-based insurance or drop into Medicaid. So you're going to have a lot of people leave the exchange by the end of the year, and that 8 million number may be accurate, may still be accurate right now. By the end of the year, it's going to be much smaller, I suspect.
We talk about the 39% or the 5.5 million who signed up, but 2.1 million, 39%, something they filled out on their application is incorrect, and it has to do with income, right?
1.2 million of them are income. Another 900,000, it's not clear if they're citizens, what their citizenship status is. Are they actually illegal aliens, or are they people here who are legal residents? The 1.2 million, though, is the people who have some sort of income discrepancy. To me, is very interesting, because I think to a certain extent the administration is itself to blame for this. First of all, they knew going in that they weren't, the technology to check people's income with the IRS wasn't going to be ready, and they went ahead with the exchange as well anyways. And then you might recall last July they said that they were going to rely on people's income statements as basically, on their goodwill, and so forth. And so when you do that, I think people are going to, we can fudge things a little bit. You're going to, and the extent to which a law is people are going to obey it is, in part dependent on to what extent the government's going to enforce it.
So then, anytime you write information down that is not correct, and it's a federal application, typically it says if you do this you could be fined or go to jail if any of the information is incorrect. What is the penalty that's attached to someone if they did fill out information incorrectly, whether they meant to or not?
It would depend on whether they did it accidentally or did it with intent. Accidentally would be up to a fine of $25,000. With intent would be $250,000.
And how are they going to be able to tell whether I intentionally did this or not? Because if I unintentionally did it, it's very subjective. If I unintentionally did it, then I still have to pay $25,000, but it was unintentional. So you don't even get off for that.
Well, I don't know, and that's the sort of thing that makes me should make people very nervous about leaving that sort of discretion up to government. If the IRS, quote unquote, or the HHS catches you, you have 60 days to appeal, and there's stuff in the regulations that allow HHS some leeway in working it out and maybe not assessing you a big fine. But nevertheless, giving the government that kind of power, I think, to try to determine when people did it with intent or accidentally should make people very nervous.
You know, something else I want to talk about that I quite frankly have not heard people talking about with respect to the Affordable Care Act is how high the premiums are. I am in the market and my premiums are very high. And when I go and talk to doctors or nurses of all races, all ethnicities, all genders, they say the same thing, healthcare professionals, that yes, it is expensive, and they too know hardly anybody who's able to take advantage of the subsidy. So the Affordable Care Act is extremely expensive, and a lot of people aren't talking about that, and I want it to because it's impacting me.
Sure. Well, it has to do with the government regulations. I mean, there are only so many ways that an insurance company can keep premiums low. One is by, analyzing your health status and your age, what's known as underwriting. The administration, the regulations largely prohibit that. So the only other way to try to keep premiums down is by limiting the number of benefits, but there are 10 essential benefits they have to provide. And so, what's left? The only other thing they can do is limit the networks, and we've seen some of that, known as the skinny networks. But when you really cut off most of the avenues, you might say, that the insurers have to keep premiums down, this is what you're going to get, very, very high premiums.
And you also talk about having to get specialty drugs.
Sure.
That if you don't have if you don't have a lot, you're not going to be able to pay for the specialty drugs.
Yeah,
they're like priced out of the market almost.
Well, specialty drugs are called specialty drugs, one, because they tend to apply to a very small portion of the population, and two, they're very expensive. Now, presumably, this is something that, the Obamacare, these are the types of people Obamacare should protect. But most exchanges are allowing insurers to have very high cost sharing on these specialty drugs. For people who get subsidies for the cost sharing, if you buy a silver plan and you make 250% of the federal poverty level or less, you get a cost-sharing subsidy for help with the deductible and other costs. Most of that subsidy, though, we've seen so far is not going to help people with the specialty drugs. I think one of the reasons insurers...
What is the subsidy going for?
For things like deductibles, co-pays. I think one of the reasons the insurers are getting away with that is because so few people use specialty drugs, they're not, contacting their politicians very much to say, hey, we want help here. People would be contacting their politicians if the subsidies weren't going toward deductibles and co-pays, which far more people use.
Right.
So one of the problems with any government system is that government healthcare system, is that the people who are the most sick oftentimes tend to lose out because they have the least amount of political power. They don't have a lot of votes, and because of their condition, they're not organizing, protesting, and doing the sorts of things that can change public policy to your advantage. And I think that's exactly what you're seeing with the exchanges and specialty drugs.
Dr. David Hogberg, thank you so much for joining us
Thank
with
you.
the National Center for Public Policy Research. Appreciate you.